program and to the studio.
Thank you for having us.
Thank you so much. Let me start with the Executive Secretary, Malam Suleiman Abubakar. Nike, for a lot of people, when you say Nike, some people are still grappling with what does it actually stand for, Nike.
Okay, thank you very much. Good morning, residents of Niger State. Nike is Niger State Contributory Health Agency. It's a social health insurance scheme, financing reform, which operates on the principles of harmony, risk sharing, and pooling of resources for the provision of affordable, accessible, and qualitative health care for residents, workforce of Niger State, and also residents of Niger State on a sustainable basis. The law of NICARE, so Niger State Contributory Health Agency is also called NICARE. Yes, NICARE is a moniker. It was established following the passing of the law of established Niger State Contributory Health Scheme in 2018. And the agency became operational almost immediately. It started taking off slowly with deployment of civil servants from different agencies so that it can start. So then the mandate is to ensure that all residents of Niger State have access to effective, quality, and affordable healthcare services, ensure financial protection for all and equitable distribution of healthcare costs across different income groups. Also, to maintain a high standard of healthcare delivery services within the health sector and ensure patronage of healthcare delivery across the board. NICARE, we have currently different programs. We have the formal sector, which is for organized private sectors and the civil servant government organization, and we have the informal sector. So for the formal sector, I am going to talk a bit about what we're doing so far and how we intend to work on it. But I'm also going to let my team speak on what we've been doing with regards to the informal sector and the formal sector. Well, before I let them speak, I'm going to talk about what the mandate we have and what this government is trying to do to achieve that. So we all know the vision is achieving universal health coverage.
Exactly.
And universal health coverage is to ensure no one is left behind, carrying people along. And from the get-go, our mandate has been clear from His Excellency, former Governor Muhammadu Umaru Bago, which states that clearly he wants to improve the health indices of Niger State. And how do we intend to do that? Making sure people have access to that. But we all understand financial hardship. So we have what we call the equity funding, which Niger State government, for the first time ever, have pledged part of that has made budgetary allocation so that we can take care of the vulnerable. Like I said, health insurance is about pooling of resources. But government alone cannot do that, hence why we have contributions from the formal sector as well. So having said that, I'm going to let Malama Habiba from the programs department to talk about the formal and informal sector.
Yes, okay. Malama Habiba, before you move into the formal and informal sector, I will also want you to talk a little bit about what is Niger State Contributory Health Scheme. He has just talked extensively now about NICARE and some of its operations. But when you say Contributory Health Scheme, what does that stand for? And then we move into the formal and informal sector.
Okay, good morning, Nigerians. The scheme, the word contributory just means that, as the ES has said, contribution of resources, pooling of resources from different angles. And that is what brings us to the sectors, the programs we are running. The formal sector will have to contribute, informal sector. Then for those that cannot contribute, there's also a provision for them. So the formal sector is based on the structure of income which comes to an individual. So the civil servants and the organized private sector fall under the formal sector because they have a structured means of income where they can make contributions sustainably. So there are also efforts that have been done under the formal sector. The agency went to all the MDAs to sensitize them about the health insurance scheme. And in addition to that, we're also engaged with some of the professional bodies like the NUJ, Nigerian Union of Journalists, the Nigerian Society of Engineers, NMA, that's Nigerian Medical Association, and so on. And discussion is ongoing with the NLC to bring all formal sector population on board. There is also the informal sector. This constitutes those that do not have structured means of income, like the artisans, the farmers, and the rest. So they pay premium on yearly basis for the health insurance. And there's also a part of the informal sector, which is the vulnerable population. They fall under the informal sector. These are people who do not have means of contributing for health insurance for themselves. Therefore, the government is taking care of some of them for now.
Typhoid, you have peptic ulcer disease. In fact, even if it's something that warrants surgery, at the primary health center, we know that they cannot operate. So they have to refer to general hospitals so that the operation can be conducted. Exactly. Just like what Haji Habiba said, that they have a premium that pay monthly, like for formal sector, and yearly for the informal sector. So, for example, the 7,200 that is for then when we started, which the premium now is 12,000, it will serve for a person per year. So with that 12,000, which is the minimum package, the minimum premium he can pay, then he will stand to benefit these elements that I said. And if it is surgery, or a woman is in labor, that she cannot deliver, that you have to do cesarean section, they will refer her to general hospital or any secondary tertiary hospital, and those tertiary hospitals will now send their claims to the agency and will pay them. So you realize that with this 12,000, you stand to benefit in surgery or treatment of over 100,000. So they stand to benefit such.
Okay, thank you so much. Okay, Madam Suleiman Abubakar, assuming you have couples that are both working, both the husband and the wife are both working, and all of them, the two of them are paying premiums. How does that take care of their how does that cover them?
Well, like I said, it covers them because in some cases, one person alone, we have what we call the principal enrollee, and you're supposed to come with a wife and 4 kids.
Yes.
So in those instances, some of them deductions will not be made for some of them. However, we have situations whereby, we come from a polygamous family, right?
Exactly.
Whereby the wife is working, we can still enroll her so that she can take care of certain number of kids. So that is still okay, and that is fine. Situations like that do not mean they will both get access to services, affordable and qualitative services.
The head of the family is also paying, and
Yes.
then the wife is equally paying. And while the payment made by the husband can cover all of them, won't that be a duplication, deducting from both the wife and the husband? Yes, go ahead.
So for that, both the spouses will be contributing. That is, their monies will be deducted from the source. But the option they have is to bring 5 other dependents.
Okay.
Yeah.
So they are both principals in this case. So each of them will come with 5 other dependents so that we can expand the coverage.
Okay. Thank you so much, Malama Habiba. Okay.